Dr. Doreen Grand-Pichet is the
Dr. Doreen is an expert in autism.
Doreen Grand-Pichet.
Dr. Grand-Pichet.
Dr. Doreen Grand-Pichet.
Dr. Doreen Grand-Pichet is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Somebody had written in and said that they're requesting to highlight biomedical intervention in autism spectrum disorders. And I know that this is a particular area that we really want to be talking more about, and I wanted to give you a chance to talk about that. But since this person asked this question, my question to you, me not being a doctor and not being a biomedical expert, but a lot of parents have talked about when they pair good ABA with some kids, not all kids, with Methyl B-12 shots, and that the language goes when that happens for some kids. I want to make sure that I put asterisks here because it's not for everybody, and obviously I'm not a doctor. But is that potentially something that they want to take a look at?
Sure. I mean, so yes, I'm very pro biomedical interventions. I have been very involved with biomedical interventions. I'm, as you know, developing a lot of training for our BCBAs at CARD so that they can always understand and assist the parents when they're carrying out biomedical or dietary interventions. So first, let's start with that because a lot of ABA folks are not pro biomedical. I'm not one of those people. That being said, like everything else, it's just very, very important that we individualize the intervention to the child. Even with ABA, I mean, if you look at it, there's no way I'm doing the same program with 2 kids, right? So that's the biggest part of treating kids with autism or individuals on the autism spectrum is recognizing how different they each are from each other and making the intervention fit the individual. So with biomedical intervention, as you said, Shannon, some people respond to the Methyl B-12 shots, others do not at all. And let me tell you, it's not an easy protocol. It is multiple shots a day, and that's pretty difficult to do. So I really would recommend that you don't start with testing out those types of things. Fortunately, with biomedical, you can do a variety of assessments, evaluations, blood tests, urine tests, stool tests, all kinds of assessments that will help you identify exactly what the issue is. Yes, if your child is a low methylator, the Methyl B-12 might help. You need to see a physician who is an expert in this area. Right now, a lot of the folks who are doing these types of interventions are part of an organization called MAPS. So you can look up the MAPS doctors or MAPS trained doctors. These are the folks that used to be called DAN trained. The organization just changed. And essentially, you want to make sure that they're trained to be able to do the assessments and identify exactly what your child needs. There's a variety of things that make a big difference in language. Some kids do very well on antifungal medications. Other kids just need various diets so that they are not exposed to the things that are acting like allergens in their system. I mean, there's so more than I could list here. There's very useful medications for some of our kids. Sometimes with our kids, it's just a matter of doing treatment to reduce the gastrointestinal inflammation. So then they feel better. So then they learn better. Sometimes it's a matter of dealing with kids who don't sleep. So their sleep improves, then they learn better. It's just, you know, treating the whole person has to do with figuring out what are the things that make this child uncomfortable, what are the things that are hurting, what are the things that distract the child, how do I allow the child, what do I have to do to help my child pay better attention and focus, and then the ABA comes in and is more effective because then we can teach the child more readily.
Wonderful.
Hey, thanks for watching Autism Live. To subscribe, click here. And if you'd like to check out some more of our videos, click here.